Good afternoon. This is the House Appropriations Committee. It is Wednesday, January 14th, 2026. We've had a little bit of technical difficulties getting things to work, but we are ready to begin. So I'd like to welcome everybody to our public hearing for the FY26 Budget Adjustment Act. Each year, we hold one public hearing for this bill. The purpose of the BAA is to review the current year budget and make adjustments as needed to tweak costs and rebalance state spending. This ensures that we keep our budget in balance and spend taxpayers' dollars in ways that support Vermonters across the state. The Budget Adjustment Act is generally not used for new programs or big policy changes. Not never, but generally not. For the public hearing, each person will have 2 minutes to speak. Megan will use the timer, which is now working, and Rep. Feltis to my left will raise her hand to let you know when you have 10 seconds left. Rep. Bloomley to my right will call the names of who is up immediately and who is on deck. If you are testifying on Zoom today, you will automatically be muted. When it's your turn, Autumn will promote you. And so please accept the promotion, unmute yourself, and be sure your video is on so we don't have technical delays. If this is your first public hearing, please note that our job as legislators is simply to listen to your testimony. We will not be asking questions during the hearing. Finally, if your time is up and you have more you'd like us to know, or you didn't get a chance to testify and you want to let us know about things, please feel free to submit written testimony. The email link was in the confirmation email you were sent, or you can submit it directly to Autumn Crabtree, our committee assistant. The committee will be reading all written testimony, so that's another option that you have. And so thank you very much for participating. And now I'll turn to Rep. Bloomley for who's up and who's on deck.
First up is Lila Bennett, and I apologize in advance if I make a mistake of pronouncing your name. Please correct it when you introduce yourself. And up next is John Sales.
So welcome, Lila. You're ready to go.
Thank you. Hello, committee. Thank you for having me here with you today. My name is Lila Bennett, and I am the Executive Director of Journey to Recovery Community Center in Newport, Vermont. We are part of Recovery Partners of Vermont. Last year, Recovery Centers had a budget request of $1.6 million to maintain programming at our centers across Vermont. This request was built from the unique needs of each member organization with local demand for services and the geographic gaps in mind. We are super grateful to the legislature and the committee for supporting $800,000 in the one-time dollars that supported recovery centers in the FY26 budget. These funds are imperative to our centers and really to assist the health of the state of Vermont as a whole for a number of reasons. Most importantly, we are saving lives in increasing numbers year after year after year. Recovery Partners of Vermont submitted recommendations for distributing the $800,000, which had consensus from all RPV members. Unfortunately, the funds were awarded at a flat rate of $50,000 across all recovery centers, with the rest set aside to be allocated per Medicaid population maps. This disconnect between how we built our request and how the funds were allocated has left 6 recovery organizations in need of additional funding to preserve the current services and avoid deficits, and that includes my center, Journey to Recovery. Today, we are asking you to please increase the one-time funding for recovery centers in fiscal year 2026 by $420,000 to help support the 6 recovery centers with budget constraints. JTR was a staff of 1 in 2020 and is now a staff of 11. And we have 2 groups per day. We average 8 people per group. We have increased the numbers of people engaging in recovery coaching rapidly every year, with a 50% increase last year in adults and 100% in students. We send people to treatment every week, an average of 2 new people per week, and we have created a recovery community here. Thank you.
Okay. Thanks. Perfect time. Thank you very much.
Yes, up next is John Sales, and on deck is Grace LaBelle.
Good afternoon, committee. Thank you for the hearing. My name is John Sales, and I am the CEO of the Vermont Food Bank. The Vermont Food Bank is seeking $1.5 million in budget adjustment FY26 funding to fully fund the Vermonters Feeding Vermonters local purchase program, which is a grant program through the Vermont Agency of Agriculture, Farm and Markets. Vermonters continue to experience food security at a rate that is increasing, And the state can support neighbors with the food they need today and support Vermont farm viability by fully funding the Vermonters Feeding Vermonters program with an additional 1.5 million. Utilizing this grant program through the Agency of Ag, the food bank purchases Vermont-grown food directly from farms and distributes it through our network of food shelves and meal sites, as well as program partners such as housing sites, hospitals, schools, and senior centers around the state. The purchasing happens in three ways. The $500,000 that was appropriated in FY26 funded large-scale direct purchases from 17 Vermont farms, and that $500,000 was all spent between July 1st and October 6th. It will help fill the shelves at food shelves and other partners around the state. Additional funding will allow us to purchase more food. We have a plan that we can spend that additional 1.5 million in the rest of the state fiscal year. The program also has grants to partners. If they want to purchase from a very small farm, they'll get a grant and purchase directly. And then also culturally responsive food. So purchasing from certain farms that can provide the foods that are desired by some of our people who celebrate different cultures here in Vermont. So the legislature can sustain this program and create economic impact for 200 to 300 Vermont farms with this additional $1.5 million. Thank you.
Thanks very much.
Thank you very much. Next up, Grace Odell, and on deck is Mike Fisher.
Welcome.
Thanks. Can you hear me okay?
Yes.
Great. Hello, and thank you all so much for having me on today. My name is Grace Odell, and I am the Executive Director of the Northeast Organic Farming Association of Vermont, or NOFA. I'm here today to ask that you support an important partner to us and support the funding request for $167,000 for the Critical Bridges to Health program. Bridges to Health is a health outreach and care coordination program for migrant and immigrant workers and families across Vermont who are not otherwise served by existing programs. There are 8 regionally based community health workers who meet needs identified by the communities they serve, and they work one-on-one with families and households to navigate an increasingly complex and very complicated healthcare system. Recent and ongoing federal policy changes and actions have made it considerably harder for immigrants and migrant workers to access needed care and services. Bridges is often the primary and often sole point of healthcare for many people in our state, including hundreds of children. NOFA Vermont and our members are particularly concerned about ensuring the continuation of this program, Bridges to Health, because it provides direct healthcare support to over 1,000 farm workers on farms across all 14 counties of Vermont, as well as supporting families in accessing food and other basic needs. It's an essential resource to ensure those essential workers on our farms and in dozens of other professions on which our state's economy relies can access the care they need and deserve. The program is facing serious funding challenges and uncertainty, largely as a result of federal policy, and may be forced to end if funding support and a long-term home for the program aren't secured. Our farms cannot function if workers are sick and can't get care. We all need to show up for these essential workers, and we cannot let this most basic safety net break. So again, we're asking that the committee support a state appropriation of $167,700 in the FY BAA to ensure the critical work can continue. And I thank you in advance for supporting this important request and standing up for these most vulnerable.
Thank you.
Yes, and we welcome Michael Fisher. And up next is Chad Simmons.
Good afternoon. I'm Mike Fisher. I'm the Chief Healthcare Advocate. Good to see you all. I am also here speaking on behalf of Bridges to Health. I have been a part of a long and tortured story about trying to make sure we have ongoing funding for this really important program. And I want to remind you that the state did pass an appropriation last year. That was a part of a bill that did not make it over the line at the end of the day. 91, I think it was. And so we find ourselves today asking for $167,700 to support a one-time transition for Bridges to Health as they move from the University of Vermont to a fiscal partnership, sponsorship with the free and referral clinics. You asked me to show up on behalf of all Vermonters and help them with challenges getting access to care, the Healthcare Advocates Office. And we do our best to do that. We have a partnership with Bridges to Help to reach this particularly hard to reach population. And I am confident without Bridges to Health, we would not be reaching this population and making sure they get the supports they need for both coverage and for care. I'm going to beat it by 38 seconds. Thank you very much.
You win so far. Thanks, Mike.
Up next is Chad Simmons, and on deck is Brent Siegel.
Good afternoon. Thank you all. For the record, my name is Chad Simmons. I'm with the Housing and Homelessness Alliance of Vermont. We exist to build a Vermont where the fundamental right to housing is enjoyed by everyone. I am here today in support of 4 FY26 budget adjustment asks for this coming year. I'll name them and explain them just a little bit. The first is $5 million for the Vermont State Housing Authority's Voucher Contingency Fund, $1.322 million for the Housing Opportunities Program HOP Financial Assistance, $1 million for the Land Access and Opportunity Board Homes for All Pre-Development Seed Grant and Community Resilience Grants, and $100,000 for End Homelessness Vermont's Disability-Focused Case Management. Vermont State Housing Authority's Contingency Fund is a proposal to ensure that the voucher program stays solvent and that folks can remain in their homes, and we prevent the further erosion and loss of housing vouchers for the state of Vermont. This $5 million fund is a vital component to the housing continuum, and rental assistance vouchers allows older Vermonters, people with disabilities, veterans, and working families to afford a home, especially during these times. The $1.322 million for the HOP Financial Assistance Program is a critical flexible assistance for people at risk of homelessness or to get people experiencing homelessness into permanent housing. $1 million for the Land Access and Opportunity Board's Homes for All Pre-Development Community Resilience Grants. LAOB is a critical partner in the housing continuum, and Homes for All and the Community Resilience Grants is needing to be restored. And finally, $100,000 to End Homelessness Vermont's Disability-Focused Case Management. Thank you for your consideration.
Nice.
Next up is Brenda Siegel, and on deck is Megan Lesage.
For the record, I'm Brenda Siegel, the Executive Director of End Homelessness Vermont. We are requesting $100,000 in the budget adjustment for disability-focused case management and concrete supports. We will be making a request in FY27, but we need this funding now. End Homelessness Vermont provides trauma-informed services to people experiencing homelessness with significant disabilities or medical complexities. We are the only organization in Vermont providing this specialized service. Between federal cuts, defunding hotel case management, and large numbers of medically complex Vermonters being exited from emergency housing, our resources have been rapidly depleted and our caseload has rapidly increased without notice. Let me share what success looks like in our program. Our client, Ernest, in Rutland, has muscular dystrophy. Other providers said he was refusing services. The reality is he couldn't get to the door without help. We've worked with him since 2023. In December, he made it into permanent housing. We continue to offer him support. In the last 14 months, we have supported 80 people with complex needs into permanent housing, with only 2 returning to homelessness. That is a 97.5% retention rate. In 2025, we answered over 3,000 hotline calls, appeared before the Human Services Board more than 250 times in fair hearings, and provided ongoing support to hundreds, in fact, thousands of Vermonters. This $100,000 will provide a disability-focused case management and concrete supports that prevent catastrophic outcomes and increase good ones. Without this funding, Vermont's most vulnerable residents lose critical support. We have been successful on a shoestring budget. Imagine what we could do with adequate resources. I ask the committee to support this request. Thank you.
Up is Megan Lesage, and on deck is Tamara High. Is Megan online or? Great,
Sorry, it was taking a minute to load.
no problem.
Okay. Just for the record, I am Megan Lesage from End Homelessness Vermont, reading Shelby LeBaron's testimony as she had an emergency. I am Shelby LeBaron. I provide service coordination and disability-focused support at End Homelessness Vermont, but I'm here because I was once a client. End Homelessness Vermont is requesting $100,000 in the budget adjustment for disability-focused case management and service navigation. I found End Homelessness Vermont when I was being exited to the street from the hotel program while I was in labor with a high-risk pregnancy. I then had a premature baby who needed in-home nursing support. I also live with disabilities myself. My family stayed safe because of the disability supports End Homelessness Vermont provided. I became permanently housed and have a healthy baby. Who knows what would have happened had we not stayed sheltered. I certainly would not be housed today, and both my partner and I would not be in career jobs. Now I provide the same critical support to others, managing medical complexities, coordinating specialized care, accessing equipment and services that keep people alive and stable. Without adequate funding, families like mine won't get the specialized disability support that they need. This $100,000 will provide the disability-focused case management and concrete supports that saved my family and saves families every day. I am safe with my healthy child because of these services. I ask the committee to support this request. Thank you.
Thank you.
Yes, and next is Tamara Hodge, and on deck is Danielle Wallace.
Camera's on you. Is she there? Okay.
Hi, I'm sorry. Things are a little slow. Can you hear me okay?
Yes, go right ahead, Tamara.
Okay. For the record, I am Tamara Hodge. I am the intake coordinator at End Homelessness Vermont, and I provide casework to support people with disabilities in their emergency housing and permanent housing. But I'm here today because I was once a client. End Homelessness Vermont is requesting $100,000 in the budget adjustment for disability-focused case management and concrete supports. We'll make a larger FY27 request, but we do need this funding now. I got to where my children and I are permanently housed and to where I was able to do this career job because of the services of End Homelessness Vermont. I know what it's like to need someone who understands disability barriers, not just homelessness, but the specific ways disability makes everything harder. That's what End Homelessness Vermont provided for me, and that's what I help to provide others with now. Our outcomes speak for themselves. 80 people with complex needs moved into permanent housing. Only 2 of those returned to homelessness, which is a 97.5% retention rate. We could not have imagined the level of crisis that was going to take place this fiscal year. This $100,000 will provide the disability-focused case management and concrete supports that prevent people from falling through the cracks. I am living proof that this approach works. Without this funding, others won't get the same chance that I did. I ask that the committee to support this request. Thank you so much.
Thank you.
Yes, now it's Danielle Wallace, and on deck is Susan Drew.
Sorry about that. Took a second. Can
We
everybody?
can see you. You're good, Danielle.
Thank you. So my name is Danielle Wallace. I'm the director of the Turning Point Center of Addison County. I'm here on behalf of our organization as well as the Recovery Partners of Vermont to request that you support the $420,000 one-time FY26 budget adjustment request. This request would help 6 recovery centers across Vermont maintain existing services during a time of rising demand. Last year, the Recovery Partners of Vermont requested 1.6 million and received 800,000, which we're extremely grateful for. However, the distribution challenges left 6 centers facing serious budget shortfalls that threaten service stability. The Turning Point Center of Addison County is a peer-led, low-barrier recovery organization. We provide safe and welcoming spaces for people affected by substance use disorder. Over the past year, demand for our services have increased significantly. Participation in recovery groups has grown by 20%. Engagement in one-on-one recovery coaching has increased by 27%. In response to these increasingly complex needs, the number of different groups we offer has expanded by 57%. Because recovery centers are peer-led and low barrier, we offer support before challenges escalate into emergencies or inpatient care. This early engagement stabilizes individuals, reduces relapse risk, and helps limit reliance on high-cost services. From a fiscal perspective, recovery centers are a low-cost, effective investment. We operate at a relatively low cost while helping reduce pressures on emergency department, in-person treatment, and other parts of the system that are significantly more expensive. Maintaining a stable recovery infrastructure supports both good outcomes and responsible use of state resources. This funding request is not about expansion, it's about sustainability. Without this budget adjustment request, recovery centers like ours face difficult decisions and could limit access to at a time when needs continue to rise. So we request that you consider this FY26 budget adjustment request for $420,000. Thank you for your consideration.
Thank you, Danielle.
Yes, next up is Susan Drew. And on deck is Lauren Glenn Davidian.
Hi, I'm Susan Drew. I'm from Elmore, and I'm the Program Development Manager for the Lemoyle Community Food Share in Morrisville. I'm here today to ask for your support of an additional 1.5 million allocation to Vermont Food Bank and budget adjustment to support the Vermonters Feeding Vermonters local food purchasing program. I believe food is the most basic human need. At our pantry, we're seeing more than 500 neighbor visits per month. We gave out close to 400 food baskets for Thanksgiving. Hunger is not going away in Lemoyle County. I believe the Vermonters Feeding Vermonters campaign is a vital piece of the puzzle that keeps our community fed. For starters, people love the fresh produce that we purchase from local farms through the program. Fresh produce is so important to a person's health and well-being. Yes, we give out canned food and produce rescued from grocery stores, but neither is as yummy as fresh, locally grown fruits and vegetables. When food tastes better, a person will eat more of it. Fresh produce beats packaged anything. I know this is true in my own kitchen and at our pantry, where the fresh produce is snapped up as soon as we put it out. Secondly, this program supports small local farmers. What will we do when the last of the farms are gone? I hate to think of it. Fresh produce will be more expensive because it will have to come from farther away. And what about the farmers? What will they do? Will they be able to stay in Lemoyle County? We already know how expensive it is here. The best solution all the way around is to support our local farmers and to support our food pantry system. FVF does both. Please, I ask for your support of Vermont Food Bank's 1.5 million request to fully fund Vermonters Feeding Vermonters. Thank you.
Thank you.
Next up is Lauren Glenn Davidian, and on deck is Sarah Launderville. No,
Lauren Glenn. Okay, why don't we skip her and we'll come back if she shows up.
yeah.
Good afternoon. Thank you for the opportunity to speak today. My name is Sarah Launderville. I'm the Executive Director of the Vermont Center for Independent Living, And I'm here to ask for your support in fully funding VCIL's Meals on Wheels program and providing a budget adjustment of $30,000. Since 1995, VCIL has operated the only Meals on Wheels program in Vermont that serves people with disabilities under the age of 60 who, because of their disability, cannot prepare their own meals. Our program exists to fill a gap, and for our participants, each meal represents nourishment and additionally independence, safety, and the dignity of remaining in one's own home and community. We support people with both short and long-term needs. This may range from short-term need from someone undergoing chemotherapy treatment for cancer who might only need a meal for a few months till they regain some strength, to serving an individual with advanced functional limitations from a disability who's no longer able to prepare their meal. No matter what the duration, the need is real, and the meals we provide help prevent malnutrition and support recovery, stability, and independence. The funding for VCIL's Meals on Wheels programs comes from the Vermont Department of Disabilities, Aging, and Independent Living. And for years, the funding provided has not covered the full expense of the program. We've worked to fundraise and to have, and we use our unrestricted funds to cover that shortfall. And this has become harder to keep up with the demand, the rising cost overall. It's important to note that the program is not eligible for funding through the Older Americans Act and any of the bills that the Vermont legislature has passed in recent years supporting other meal programs. While we currently serve many Vermonters every day, we currently have a waiting list. Your support will have a direct impact and immediate impact. By investing $30,000, you can ensure that Vermonters with disabilities under 60, whether facing temporary medical challenges or long-term functional limitations, are not waiting or hungry and will continue to live with dignity. Thank you so much.
Next up is Jenna O'Farrell, and on deck is Susan Aronoff. Jenna with us?
Yes.
Hello?
Yep, we can hear you.
Back
Thank
on?
you.
Great.
You're on.
Sorry, something happened. I'm Jenna O'Farrell, St. Johnsbury, Executive Director of Northeast Kingdom Community Action. And I also represent the Vermont Community Action Partnership, which consists of SEVCA, Brock, CVOEO, and Capstone. Today, we are requesting the Budget Adjustment Act to allocate funding for the Financial Assistance Program to the amount of $1,322,141. Through the Housing Opportunity Program, financial assistance funds provide short-term or one-time financial support to individuals and families who are experiencing homelessness or at imminent risk of becoming homeless. These funds are designed to quickly stabilize households by safely diverting them from homelessness or supporting rapid exits from housing instability. Financial assistance is a critical homelessness prevention tool. Historically, this funding has allowed us to support households with a full 3 months rent of rental subsidy. Due to reduced funding, we are now limited to provide a maximum of $1,500 per household. This reduction has significantly limited our ability to help families or retain secure housing. In many cases, this assistance has only covered 1 month of rent in market rate units, which is often insufficient to preventing eviction or homelessness. The reduced capacity directly correlates with an increase in individuals and families remaining homeless or becoming homeless, placing additional strain on the general assistance system. Housing providers must be fully restored this year to effectively support Vermonters who are the most vulnerable to eviction. These funds have preserved housing, create pathways to stability, kept families together during periods of extreme stress, offered individuals and families the opportunities for a fresh start. Continued investment in financial assistance is essential to preventing homelessness and reducing system-wide strain. Additionally, VCAP supports the BAA requests of HHAV and End Homelessness Vermont. Thank you.
Thank you very much.
So up next is Susan Aronoff, and on deck is Michelle Edelman McCormick.
Good afternoon, everyone. For the record, my name is Susan Aronoff. I am the Senior Planner and Policy Analyst for the Vermont Developmental Disabilities Council. Thank you for the opportunity to testify. I really enjoy seeing all of you in person. This is, I think, my first time in your committee this year. Before I testify, I always have to give this disclaimer. My apologies. It's in our written materials as well. I am a state employee. Any of you get email from me, see that my address is vermont.gov. I'm housed in the Agency of Human Services. However, whenever I speak, especially about matters related to the budget, I always have to clarify that I work for an independent council. The Vermont Developmental Disabilities Council is one of 56 developmental disabilities councils in the country. Every state and territory has one. Ours in Vermont happens to be entirely federally funded. So I'm not here asking you to support my salary or the good work that we do. However, I'm asking you to support the good work that a lot of our partners do. Some of it's in the governor's recommended budget and some of it isn't. And what I need to always say for the record is that while I'm in the Agency of Human Services and a state employee, we have a signed memorandum of understanding from Secretary Jenny Samuelson, AHS Secretary, that allows us to advocate as we were created to advocate to support the rights of people with disabilities and their family members everywhere decisions about their lives are made. So that includes in the State House, Board of Education, other places. So today, so that was probably half my time remaining. We support HHAB, Land Access and Opportunity Board that we're a member of, and they are moving things forward, hooray. And the Vermont State Housing Authority's vouchers, please, we need those vouchers. And the Vermont Center for Independent Living as well, thank you. Please, if you have a chance, read our written comments. And thank you for all of your work.
Thank you. And you can submit written testimony. Thank you.
Next is Michelle Edelman McCormick, and up on deck is Michelle Fay.
Is Michelle here? Not seeing Michelle.
All right, so we'll hold on.
Well, we have two Michelles. Is Michelle Fay here?
Yeah, she's on.
Oh, she's on Zoom? Okay. All right. There's Michelle Fay. Okay.
Hey.
Hi, I'm Michelle Fay with Voices for Vermont's Children. Thank you for the opportunity to speak on behalf of the more than 6,000 Vermont children who depend on Reach Up for their basic survival needs. Year after year, the administration puts forth a budget that keeps the Reach Up benefit for the most disadvantaged families below what is considered deep poverty, or 50% of the federal poverty level. Vermont law directs DCF to, quote, as far as funds are available, provide a reasonable subsistence compatible with decency and health, end quote. The legislature appropriated $36.5 million to Reach Up this year. The department could comply with the law and bring the benefit level closer to meeting a reasonable subsistence by adjusting the maximum Reach Up grants by rule to align with the appropriation. Instead, year after year, they make policy via budget adjustment by doing the opposite and redirecting the funds you've appropriated for Reach Up to some other purpose. It's no coincidence that 113 Reach Up families were housed in the GA Motel program last month. Unknown numbers of families are in even more precarious settings. 275 families were on a wait list for a car last year to overcome one of the top barriers to securing employment. We cannot expect to bend the curve on the numbers of children in extreme poverty while our policies relegate them there by design. What's more, the caseload reductions are in part driven by the frozen benefit level. When the grant doesn't keep up with the cost of living, even a small amount of earned income can bump families off the program well before they achieve economic security. The budget is our most powerful statement of values and priorities. Permitting this annual exercise of balancing DCF's budget on the backs of the most economically marginalized children is harmful policy, and we need a new precedent. Voices request that you require funds appropriated for Reach Up to be used within the program until its statutory purpose is achieved. The advocacy community and impacted families stand ready to support DCF in determining the best use and in modeling a more humane and effective benefit structure moving forward. Thank you.
Thank you. Next, we'll hear from Mary Kate Molman, And on deck is Reverend Mark Hughes.
Okay.
All right, good afternoon, Madam Chair, members of the committee. Thank you for the opportunity to testify today about funding currently included in the FY 2026 Budget Adjustment Act. As Bi-State Primary Care Association's Director of Vermont Public Policy, I represent our members, including Vermont's Federally Qualified Health Centers, also known as FQHCs, Vermont Free and Referral Clinics, and Planned Parenthood of Northern New England. Bi-State Primary Care Association is a nonprofit organization established in 1986, so we're celebrating our 40-year anniversary. But we advance access to comprehensive primary care and preventive services for anyone, regardless of insurance status or ability to pay. I specifically would like to express my support for the Budget Adjustment Act, including an inflation adjustment factor to the Medicaid FQHC rates. The state has annually applied this Medicare Economic Index inflation adjustment to FQHC rates since Congress established the current FQHC payment model in 2000. This adjustment is critical to ensure that Medicaid rates remain in line with the cost of providing care to Medicaid enrollees. Last session, legislators demonstrated their support for FQHCs and comprehensive primary care and preventive care by increasing FQHC rates last July after several years of underfunding. For that, we thank you. Adjusting FQHC rates by MEI and the BAA ensures that we do not lose the ground we gained this past year, especially in the face of federal policies jeopardizing several other funding sources for FQHCs. Vermont FQHCs serve approximately 1 in 3 Vermonters, provide physical, mental, and oral health services, and their continued financial stability is essential to maintaining access to this important care. Bi-State and our members, thank you, and we hope you can continue to support us through the Budget Adjustment Act. Thank you.
Thank you.
We'll next hear from Reverend Mark Hughes, and on deck is Linda Ramsdell.
Good afternoon. Can you see me? Oh,
yes.
Here I am. All right, good afternoon. My name is Reverend Mark Hughes. I'm the Executive Director of the Vermont Racial Justice Alliance, and I'm here to speak in support of protecting Vermont's civil rights infrastructure. This in the face of federal infrastructure being decommissioned, gutted, and politically repurposed. Over the past year, the federal government has sharply reduced civil rights enforcement across housing, employment, education, environmental justice, and public safety. In Vermont, this has a real and immeasurable economic consequence. Based upon state budget documents and agency data, Vermont is already losing approximately $170,000 annual in direct federal civil rights enforcement funding. More significantly, the Vermont Human Rights Commission has documented the need for nearly $900,000 per year in additional state funding, simply to maintain basic enforcement capacity as federal agencies retreat and case volume shifts to the state. Beyond enforcement, Vermont faces a broader shock. Federal pauses and cancellations affecting education, housing stability, public health, transportation, and environmental justice total approximately $40 million or more in a single year. These losses increase discrimination risk, destabilize housing and employment, and ultimately drive higher downstream costs in healthcare, homelessness services, litigation, and lost productivity. In short, federal civil rights retrenchment is not cost neutral. It transfers risk and expenses directly onto Vermont communities and the state budget. Strategic state investments now is fiscally prudent, constitutionally necessary, and far less costly than unmanaged harm later. Vermont has an opportunity through the Budget Adjustment Act to stabilize its civil rights enforcement capacity, protect equal protection, and prevent preventable economic damage. Finally, I want to express strong support for the governor's recommended budget readjustment for the Land Access Opportunity Board. Expanding equitable access to land directly addresses structural barriers rooted in discrimination, strengthens food security, and builds long-term economic resilience. This is exactly the kind of forward-looking, justice-centered investment Vermont needs at this moment. Thank you for the opportunity to testify.
Thank you very much.
Now we'll hear from Linda Ramsdell, and on deck is Emma Paradis.
Good afternoon. My name is Linda Ramsdell. I'm the board president of Headwaters Community Trust, a community land trust formed in 2024 to serve the Northeast Kingdom towns of Albany, Craftsbury, Glover, and Greensboro. I'm here today to express support for the Land Access and Opportunity Board's Budget Adjustment Act, with a particular focus on funding two essential programs, the Beginning Developers Pre-Development Grant Fund and Resilience Hubs. My remarks focus on the Beginning Developers Pre-Development Grant Fund. Community land trusts support community-led development on community-owned land. The Beginning Developers Pre-Development Grant Fund fills a critical gap in the development ecosystem. In our rural service area, mostly without zoning or public infrastructure, pre-development costs can be prohibitive and are the reason traditional developers go elsewhere. The Beginning Developers Pre-Development Grant Fund could make it possible for Headwaters to bring community-driven visions to life. By funding this program, the board empowers local talent, expands the pipeline of community-rooted development, and ensures that homeownership is available for the people who want to live and work in our towns and not determined solely by wealth. This is how we care for the next generations and build generational wealth and diversify the fabric of our towns. The Beginning Developers Pre-Development Grant Fund and Resilience Hub programs are strategic investments that will directly impact our work and enable us to care for our neighbors and strengthen our communities by creating permanently affordable homes and access to community-owned land. Together, these two programs reflect a strategic investments in community transformation. I urge the committee to fully fund these initiatives and affirm the Land Access and Opportunities Board's role in creating a more equitable, resilient, and opportunity-rich future. Thank you for your time and your commitment to this work.
Thank you.
Now we'll hear from Emma Paradis, and on deck is Mary Beth Pinard.
Good afternoon, committee, and thank you for the opportunity to speak today. My name's Emma Paradis, and I represent Common Good Vermont, which is a statewide program of United Way of Northwest Vermont dedicated to uniting, strengthening, and advocating for Vermont's nonprofit sector. I want to acknowledge the reality that you're facing. Vermont has many competing priorities right now, and that's why this proposal is about managing chaos and not adding to it. Federal policy changes and funding uncertainty are already rippling through Vermont's nonprofit sector. These organizations employ 1 in 5 Vermont workers and deliver essential services that keep our communities and our economies functioning. When nonprofits falter, the state feels it immediately. Layoffs, service disruptions, and emergency interventions that cost more and help fewer people. Our proposal, endorsed by 60+ nonprofits, requests $295,665 in one-time funding through the BAA to provide technical assistance to nonprofits navigating federal impacts, including planning for major funding swings, adapting business models, and when necessary, supporting mergers, consolidations, or orderly wind downs to protect clients, workers, and public investments. This proposal speaks specifically to the funds set aside last year for federal impacts in Act 27. We also request $267,000 in base funding to strengthen financial management and compliance for organizations with state grants. This is not about preserving the status quo. It's about ensuring transitions are managed responsibly, services remain stable, and that public dollars are used efficiently rather than in crisis mode. When nonprofits fail, families lose access to childcare, housing, and healthcare, costs that ripple through the economy and land on the state. With foresight, we can avoid service gaps, protect jobs, and prevent larger costs that will be landing on the state later. In short, this is an investment in preparedness. It aligns with the recommendations of the Treasurer's Task Force on the Federal Transition and gives Vermont a way to manage change deliberately rather than react to disruptions after the fact. Thank you for considering this, and I've submitted written testimony.
Thank you very much.
They had, I watched a webinar where they had Blackbaud on and they were asking Blackbaud.
Somebody's got a computer going.
So it's definitely helpful.
You guys stop. Oh. Well, this is Mary Beth Pinard. I'll bet.
Yes.
And on deck is Jim Moulton. Welcome.
Great. Good afternoon. My name is Mary Beth Pinard, and I'm the Executive Director of Vermont Catholic Charities. Among our programs are 3 residential care homes in Rutland, Burlington, and Derby Line. I'm also a member of the Long-Term Care Crisis Coalition. This coalition represents more than 200 providers of long-term care. We've been working with policymakers for several years to bring Medicaid reimbursement for home and community-based services closer to our actual costs of providing these services. As part of this multi-year effort, the legislature allocated funding in the 2026 state budget to increase the enhanced residential care rates paid to assisted living residents and residential care homes. Providers were taken by surprise when the state chose to distribute funds intended for a rate increase by paying more at some levels of care while reducing payment at others. Our reimbursement for Tier 1 service dropped by 35%. That is unsustainable. Budget testimony around this issue did not include any indication that rates would go down. Budget instructions from the legislature directed the state to use the funding to address rates that remain below the recommended levels. When the legislature appropriates funding for Medicaid rate increases, that action should not result in surprise decrease. We are asking for the Budget Adjustment Act to restore Tier 1 enhanced residential care rates to their previous levels. We see this as a technical correction. The adjustment would be made to the Department of Disability, Aging, and Independent Living budget. Thank you for your consideration to this request.
Thank you very much. Next, we have Jim Moulton, and on deck is Meg Burmeister.
All set, Jim.
Thank you. My name is Jim Moulton. I'm the Executive Director of Tri-Valley Transit, serving Addison, Orange, Northern Windsor, and soon to be Washington counties. I'm also the Vice Chair of the Vermont Public Transportation Association. We provide non-emergency medical transportation through the Medicaid program around the state. The non-emergency medical transportation program takes low-income Vermonters to treatments for substance abuse, kidney dialysis, cancer treatment, regular preventive maintenance appointments, vaccinations, and pharmacies. This program is an entitlement program, and in fiscal year 25, we were faced statewide with an $800,000 deficit, and we're hoping that the committee can provide that some relief against that loss. Again, it's an entitlement program. We have no ability to cut service, and we have no ability to cost shift our expenses from the Medicaid program onto other programs. So we have to endure different ways of figuring out how to meet that budget deficit. Without assistance from the legislature, we are in jeopardy of our other public transit services because we need to cut costs somewhere. And those services are relied upon by thousands of vulnerable transit-dependent riders. The Medicaid program does almost 300,000 trips to the lowest income riders in our state, and we are being driven by administrative burdens of 2.5 times more labor-intensive than the program for older and disabled Vermonters, and insurance costs, which rose by over $1 million statewide in the past fiscal year. Thank you for considering our request.
Thanks, Jim. And next is Meg Burmeister, and on deck is Aiden Carpenter.
Hi, can you hear me?
Yes.
Okay, my name is Meg Burmeister. I'm the Executive Director of the Northeast Kingdom Council on Aging. And I'm here testifying on behalf of the 5 area agencies on aging in the state of Vermont. Last session, the legislature appropriated funding for a 2% Medicaid rate increase. Thank you to Representative Yakavone for advancing the effort in the FY26 budget. During budget discussions with your committee and the Joint Fiscal Office, it was clear to us that the intent, and we believe the committee's understanding, was that the AAA case management would be included in the 2% increase. However, Dale did not include the necessary funding for this 2% increase. We are requesting that funding be added to the BAA to cover the 2% increase, to reflect what we believe was the legislature's intent last session. This increase is necessary to maintain the quality of services that the home and community-based services system relies on. Throughout the last 2 years, the role of case management has undergone a significant change in response to a federal rule that impacts conflict-free case management. For the 5 area agencies on aging, this meant a significant effort to scale up to a dramatic shift in volume of work, which doubled, and staffing needed to handle that, all while supporting frail elders in the community who choose to remain in their homes for their long-term care needs. This shift results in financial stressors for the AAA network. As workforce stability is crucial, we are continually seeking a lack of funding to meet the workforce demands that we are confronted with, and the demands change. It presents us with more complex clients who present with greater frailty, multiple health conditions, and increased need for advocacy and coordination. In a system where healthcare costs are exceptionally high, we need your support. Dale has indicated they cannot ask for a federal match retroactively, so we will only benefit from the match for the last quarter of the fiscal year. As such, we are requesting a general fund appropriation for the full amount for the first 3 quarters and general fund plus match for the fourth quarter. Thank you for your time and consideration.
Thank you very much.
Now we heard from Aiden Carter. And we'll see if anybody else is online who we passed over. Okay.
Committee, thank you for the opportunity to testify. My name is Aiden Carpenter with Zatz and Renfrew Consulting, and I'd like to share some testimony from our client, Melissa Farr, the Executive Director of Vermont Cares. So I am testifying on behalf of the 3 AIDS service organizations in Vermont: Vermont Cares, the AIDS Project of Southern Vermont, and the HIV/HCV Resource Center. The fiscal year 26 HIV/AIDS budget included funding for client-based support services, HIV harm reduction services, and syringe services. Given the increasing need in our communities for harm reduction and emergency assistance, without a budget adjustment, we face great challenges in getting through this fiscal year. We will not be able to continue to provide compassionate and consistent support to the Vermonters who rely on us every day. The cost of doing this work has risen across the board. Staffing, rent, insurance, utilities, transportation, and supply expenses have increased significantly, while funding levels have not kept pace. Our work requires skilled people supported by resources that are sustainable and not constantly at risk. Flat funding does not allow organizations to keep up, let alone build the capacity needed to respond to what is happening in our communities right now, when both those living with HIV and people who use drugs are targeted daily. For people living with HIV and people who use harm reduction services, our programs are often the first and sometimes only place they feel safe asking for help. Many of the people we serve have faced stigma, judgment, or outright rejection elsewhere. HIV prevention and care and harm reduction services are effective because they are rooted in real relationships and evidence-based practices. They prevent new infections, reduce overdoses, and connect people to treatment and stability. Our services keep people alive. We are already seeing the impact of when funding does not keep up. The current closure of the Pride Center of Vermont and the Center for Health and Learning, which focus on statewide suicide prevention and young mental health, have put a greater strain on our organizations. We are requesting a $45,000 budget adjustment increase in section E.312. Thank you.
Thank you very much.
And I saw that we don't have anybody else.
We don't have anybody else, so the 2 that didn't show. So that concludes the public hearing. We thank all of you that came and testified. And as I said before, if you can give us written testimony to help us with what you did, you can just submit it to Autumn. If you haven't already done so, that's always helpful, not required, but it's good to have that. And with that, we will take a break and we'll come back in about 15